Hello, everybody. Steve Edelman here, my good friend and colleague, Schaefer Boeder.
Hi.
We're both endocrinologists at UCSD in San Diego. We also work at the Veterans Hospital. And today we're going to be running the TCOYD Facebook Live on continuous glucose monitors. I have type 1. I have a lot of personal experience. He does not have type 1. I call all non-type 1s losers. And he's used to that.
Yeah.
And
I embrace it.
We're going to start off with some general comments, but really this Facebook Live is for you to ask questions. And many of you have already sent in a bunch of questions, which we appreciated. So I'll let Schaefer start off. And I think the overall goal of this Facebook Live is obviously to answer your questions, but bring out the importance of CGM.
Yeah. So, this whole talk is on CGM. We're going to be touching on, answering questions for people with type 1 diabetes, type 2 diabetes, sometimes even, people who have pre-diabetes, and all the benefits of CGM, which I think even today, as CGM becomes more and more accepted and more available, there's a lot of people living with diabetes who just don't really understand it and maybe don't have a good grasp of the benefits of CGM for them. And that the same could be said for providers. I think a lot of providers, even endocrinologists, but certainly other providers, just are uncomfortable with the technology. It's hard to keep up with because things are improving and moving so quickly. So that's what today is about, just trying to get caught up to date, answer questions, and really kind of dive into the benefits of CGM.
Yeah, and I have to say that TCOYD, we were ahead of our time because we thought CGM is the standard of care for people with type 1, and that has come to fruition, and it's going to be for type 2 as well. Mm-hmm. We just did a video that you should see soon in our next newsletter talking about CGM in type 2. Mm-hmm. Let me just say a couple of things about type 1, and you can maybe summarize some of the stuff we talked about with type 2.
Sure.
It is the rare person with type 1 diabetes that could not benefit greatly, underscore greatly, from the use of a CGM device. And I'd say one of the most frustrating things I deal with in clinic is when I see someone with poor control, have all kinds of issues, and they refuse to accept an offer for a CGM. CGM is approved now by every insurance company. There's no question. That's a different story in type 2. And we're going to talk about some of the benefits in a second, but the bottom line is when you have a device that tells you your blood sugar every 5 minutes, gives you trend arrows, you have high and low alerts, and you set those correctly, we'll talk about that, it can change your life tremendously, improve your time and range, which is officially defined as the percent of time your blood sugars are between 70 and 180. Hopefully we get it to 70% or higher. And so, we can talk the whole hour on the benefits of CGM, but we want to get into other issues. So maybe you can talk about CGM and type 2, because a lot of doctors are saying people with type 2 don't need it.
Right. Yeah. And that's changing as these devices become more available and even directed, specifically designed for people with type 2 diabetes. The type 1 diabetes, people require insulin, multiple daily insulin shots throughout the day, or an insulin pump. Some people with type 2 diabetes also require multiple insulin shots. And so for those people, it's obvious. It's really a no-brainer whether you have type 1 or type 2 that a CGM can really add to your taking control of your own diabetes and managing it, and also can help your provider help you. So if you're on insulin, especially multiple shots, or on an insulin pump, everybody, doesn't matter, type 1, type 2, really a CGM, we think of it as standard of care. Now, if you have type 2 diabetes and maybe you're not on multiple different shots of insulin or a pump, but maybe you use a once a day shot, like a basal insulin, something like that, well, there's still a really good benefit to CGM. And so we know that people who are on insulin, and also some of the pills, things like sulfonylureas, glipizide, glimepiride, things like that, you can have low blood sugars, hypoglycemia. And so having a CGM can be protective against low blood sugars. So being able to kind of know that you're having low blood sugars, know when they happen, and use that information to help adjust your medications can be hugely beneficial, even if you're only doing a once a day insulin shot. And in some cases, if you're just on pills. And then I think the final, group of people, not even the final group of people, so people who have type 2 diabetes but are on no insulin, just on pills, could even be just on metformin, or someone who has pre-diabetes but knows that they have some glucose issues, then the CGM really becomes a device for your information to help you make good, healthy decisions. You can see what happens to your blood sugar after you exercise or while you exercise. You can see what different food choices and different amounts of food, do to your blood sugars. And that can really help you make major changes and inform you in what changes need to be made. Because otherwise, I think it's really hard for us to know, what effect those things have on our blood sugar and ultimately on our health. So it's an information tool.
And you said it great in the beginning. The information is really for us folks living with diabetes primarily, for the healthcare professionals secondarily. And, believe it or not, there's either another group of people that are using CGMs, people that do not have diabetes. There's a company called Super Sapiens that uses continuous glucose monitoring to help elite athletes fuel at the right time. And there are other companies coming up to help with obesity and other lifestyle issues. So CGM may be a really routine part of our whole society at some point in the future. Let's talk about the different devices.
Yeah.
I can start off with the Dex Com G6. The Dex Com G6 is a device that I've been wearing for many years. It has a sensor that goes in the skin. It lasts 10 days, and then you put a transmitter in. And we can talk about the G7 later. That's the next edition. And the data goes right to your cell phone or a monitor. Believe it or not, I use both, and I can tell you later when we talk about alerts. And you put in your own upper and lower alerts. It gives you very nice software to look at your averages, your standard deviation, your time and range, the overall 24-hour profile, how much you're bouncing around, and a lot of data. And once again, the data is for you, not necessarily for your healthcare professional. Although sometimes if you look at it on a day-to-day basis, you may not pick up trends and patterns that your healthcare professional may see when they look at the 90-day average.
And as a provider, I can tell you it's hugely beneficial for me. And it makes, the visits that I have with my patients who have diabetes so much more meaningful.
It's the whole visit.
Yeah, it's really what we talk about. And we download that, we look at the trends, we make, we come to decisions together on how to improve blood glucose based on those things, reduce hypoglycemia, whatever it is. So for me, it's, as a provider, it's everything. But of course, you see your provider once every 3 months, 6 months, whatever it may be. Yeah, if you're lucky. And for 15 minutes, 20 minutes, or maybe half an hour, again, if you're lucky. So the rest of that time, it's for you to use.
Yeah. And, the other thing is there are these new devices now, hybrid closed loop systems. You have the Tandem Control IQ. You got coming up the Omnipod 5. You have people that do the looping with the Riley link. You have people on the Medtronic 670G, 770G, and soon to have the 780G. And they communicate with the Dex Com, and they modulate your insulin on small levels up and turning it off when it predicts low. And I'll tell you what, when I see those patients in clinic, we don't have much to talk about. Their numbers are so good. All we talk about is your favorite Peloton instructor.
And once everybody gets on those, then I think you're working at
Starbucks, is it? Starbucks, yeah.
So we've really seen a shift. Now, some of the other CGMs that are available out there, Abbott it's a company, Abbott makes two different CGMs that are currently available in the United States, the Freestyle Libre 1 and the Freestyle Libre 2. Basically, the 2 is a little bit of an upgrade from the 1, but they're both, have been really important and widely used CGMs. They're considered a flash glucose monitor. So like the Dexcom device, you wear, a small sensor on the body, and then you carry a little standalone receiver like this. You flash it over it, and whenever you swipe it over that, it gives you what your blood sugar is right at that moment. So the Freestyle Libre 1 and 2 don't currently send that blood sugar information automatically to anywhere, like the receiver or your phone or an app or anything like that. That's not how those ones work, but they're available anytime you swipe. And then it also uploads the last 8 hours of glucose data. So you still have, if you're swiping enough, you still have all your blood sugars available for you and your provider to look at trends. The Freestyle Libre 2, the big upgrade, which I think is actually quite important, is that you can set alerts and alarms so that it notifies you if there's a high or low blood sugar, and then you can swipe and see what's going on with your blood sugar from there. So those are the Abbott devices. Really, use more and more. And the Abbott 3, the Freestyle Libre 3, is, a future device, kind of like the Dexcom G7, future generations. And, we can talk about those a little bit. The important thing is that these are getting better and better all the time.
Yeah.
And the current devices are pretty amazing.
Competition's good too.
Yeah, it's a good thing.
And the Libre is 14 days, as you mentioned, and the Dexcom is 10 currently. And then just quickly, there's a company called Senseonics that has collaborated with Essentia. They make a completely different model, a implantable sensor. So it comes down to you get this thing put under your skin in a quick office procedure, and then you have a phone with Android or cell phone, and the data goes there via a little transmitter that you put over the implanted sensor. So it's a different form factor for people that maybe do a lot of water sports or just don't want to have the subcutaneous sensor. So it's an option, and it always comes down to personal choice. And then of course, Medtronic is the company that came out with the first hybrid closed loop system, the 670G, and they have their sensor as well.
Yeah. And I think, you can look online and compare these different things and, talk to your provider, talk to other people who have used CGMs to kind of get their input. There's a lot of great YouTube videos of users. And, so if you're interested in this, there's a lot of good information out there if you're trying to decide. Some of the devices don't require finger sticks at all. And those include the Freestyle Libre and the Dexcom. So, they really kind of allow you to not prick your finger, but yet to have all that information, way more information than you can get than doing finger pricks.
Us diabetics, we hate pricks. Now we have a bunch of questions, so we should stop blabbing and answer some of these questions.
Let's get to it.
Okay, go for it. What do you think the first one is?
So let's get into these questions. Okay, good. So we brought up these ideas of alerts and alarms. And so this is the first question. How do I know what glucose I should set my alerts at? So are there certain limits that you should use? And it's a great question. And I think everyone needs to think about this because it may be different for everybody, but also, whatever comes factory calibrated might not be perfect for you. You want to adjust those to really get the most use out of them.
Yeah. First of all, it's a mindset. Alerts are your friends. Yeah. You embrace the alerts. And if the alerts are driving you crazy, they're set incorrectly, or your control basically sucks. And you've got to improve that. I know that many of the spouses and significant others, the alerts drive them crazy as well. Just to start off, typically 80 to 180 is a starting point. But let's just say you have a very high A1C, you're brand new to CGM, your blood sugars are typically over 200. You set yours for 180, it's going to drive you nuts. And it doesn't mean you can't change your alert levels over time.
Yeah.
If you have something like hypoglycemia unawareness, you don't want to set it at 65 because by the time it alerts, it's going to be way past the point of what you should have done and get some juice. So, like you said, Schaefer, it's an individual. I'll just say one last thing is that I just saw a patient in clinic. She's a really smart pharmacist. She's got type 1. And she said to me, my time in range, 70 to 180, is too high. What should I do? And she really was on all the best, pumps and insulins. And I looked at her alerts, and her upper alert on the Dexcom was 250.
So she wasn't getting alerted in time until she was already way too high.
And
to do anything about it.
Yeah. And so for her, it was a simple solution. We just lowered it down to 200, eventually down to 180.
Yeah. So I think the alerts and alarms can do two things. If you're on insulin, if you're using multiple, shots of insulin or a pump, then the alerts and alarms can help you decide when you're going to take action, right? So if you're going to take action, you want to know about it. Certainly on that low alert, you want to be able to take action by treating a potential low, preventing it from going low, which is why you don't want to wait till it's already low. You want to catch it when it's 80 or 90, maybe even 100 if it's an issue for you.
Yeah.
And on the high side, same thing, right? You want to know before you really get high so you can give a correction bolus or something like that. If maybe you have type 2 diabetes and you don't use short-acting, fast-acting insulin, and you say, well, what am I going to do with these alerts? Well, then it's really for you to help learn, what's going on with your blood sugar.
Yeah.
So set those alerts and alarms. Say, hey, I really want to know if my blood sugar is going higher than 200 or over 250 when I eat this meal. Then it's going to alert and you're going to say, holy cow, I just ate that fudge sundae and now I'm 260. And so it's part of that learning process. So you have to find the balance for you where you're going to get the benefits out of it and able to, without getting alarm fatigue, which is where you just too many alarms.
Yeah. And the other thing I'll say is that my own personal technique, and I can't believe I'm divulging my secrets, but I'm in competition with Dr. Jeremy Pettis on who can have the best time in range. So I realized, it dawned on me after being on CGM over 10 years, I put my upper alert, believe it or not, I know some of you are going to roll your eyes, at 150. And I changed the sound of the alert. So it's not obnoxious 2 beeps. It's like a mellow sound. So now, instead of going, damn, I'm above 180, because that's where it used to be, I changed the sound. And when it goes off at 150, I go, yeah. And I look at the number, and if it's straight across the trend arrow, I don't do anything.
You're good to go.
And if it's going up, why not catch yourself before you get to 180?
Yeah.
And I'm not trying to brag, but on a bad day, my time in range is in the 80 percentile. So I've changed my mindset. I love my alerts and alarms.
Yeah.
I know you think I'm crazy, but I tell you what, for me, it works.
Yeah.
And different strokes for different folks.
So here's 2 sort of related questions. One, how do I turn off the alert sounds like when in a theater? So just, is that something you can do just basically for a short period of time, turning off your alerts? And then another question is, someone who's having a lot of alerts, especially at night. This is someone who sounds like they've had low blood sugars though. So they had turned those alerts off because they're bothering them when they were sleeping. So how do we deal with those types of issues? Just the alarms going off?
Yeah, well, I'll just say that movie theater, I haven't been to a movie theater in 2 years, but if you're getting your information on your phone, you just push your phone on vibrate. The only time it'll go off is when you get below 55 with the Dex Com. With the Libre, it's a little bit easier to turn everything off. Well, here's the thing. I think a lot of people get alarm fatigue at night.
Yeah.
Because it wakes them up. They can't get good sleep. I would say this, that on the upper end, you can change your alerts in 30 seconds. So some people may, and you can set times of the day where your alerts are different. So you might turn off your high one at night just so that you take off that, alert that wakes you up.
Yeah.
For the low end, it really depends on you. Have you had an unconscious reaction? Have you had a seizure? And I think the other thing to point out is this lag time.
Yeah. Right.
So maybe you can describe
so we'll talk about lag time. So,
okay.
I do want to say, just to add on what you're saying.
Finish that. Yeah.
If you're having lows so frequently that the alarm is bothering you, then it's not the alarm's fault. Then you really need to take this back to what's going on with your treatment, reducing your insulin and fixing those lows, because that low alert is so important to protect you. So if it's a low alert problem, I'm having so many low alerts,
there's something going on.
There's something going on.
Yeah.
So the lag time is a really good question. So lag time is basically, okay, so you're wearing this sensor on your skin. It has a little tiny filament that goes right under the skin, and that's where it's measuring the glucose. And so it's not, in your vein. It's not exactly knowing what your blood sugar is doing at that exact second in your bloodstream. So it takes a little bit of time for it to measure. Basically, it basically lags behind what's really happening in your blood by some amount of time. And it's usually, it's in minutes, but the amount of time that it lags behind is actually changes based on how quickly the blood sugar is changing. So if your blood sugar is shooting up or falling rapidly, then that lag time makes a big difference, because let's say it lags behind 15 or 20 minutes, if your blood sugar is changing rapidly, it could be really different 20 minutes from now. And so the lag time is an important problem. And I would say it is a limitation of CGM. But I think there's 2 things to say about that. One is your actual number is very important, but your glucose trend is just as important.
Yeah.
And that's what we want to see. So if your blood sugar says, hey, I have a down arrow, I have an alarm going, my blood sugar is going straight down, but my CGM says it's 90. Well, it's probably actually lower than that. And so you need to be aware that, hey, use that trend arrow saying, hey, I'm 90 now, but I'm falling. Well, you might be low already.
That's extremely important. The trend, if you have 2 arrows going down, if your blood sugar says 70, you might be 45 or 50. And the lag is on the way up as well, but it's the opposite.
Mm-hmm.
If your blood sugar is 150, it might actually be higher than that. But that's not as dangerous as going down. The other thing I wanted to say, that there was a question on there, what is the repeat high and repeat low alerts?
Mm-hmm.
That's really important. The repeat high means that if you get to your upper limit, let's just say 180, you push off, and then if you're still above 180 in 2 hours or 1 hour, you can set the time, it'll alert you again. And that's key because, some of the patients I've seen, I look at their download and their blood sugar is like 210 the whole day. I say, well, isn't your isn't your alert going off?
Yeah.
And their repeat high comes factory set as off.
So you get one alert and then you hit it
You're
and you forget
busy.
about it. Yeah. And yeah, so sometimes we call it the snooze button, but it's basically to be there to remind you again in the future. And I think it's important for high. It's also, again, very important for lows. So if let's say you're setting your low alert at 80 and your high alert at 200, we oftentimes will say, well, we should have your low alert repeat every 15 minutes, because if you're still low 15 minutes from now, you should know that, right? You don't want to leave that and forget it. The high alert, we tend to spread out a little bit, maybe 2 hours, so that if you're still high 2 hours later, then time to go for a walk or do something.
So you don't stack your insulin and stuff like that.
Yeah. Good.
All right. Okay. We're getting there. Good questions. Love it.
Let's keep going. Let's talk a little bit. So, we talked about this lag time. Let's talk a little bit about sort of accuracy and the need for finger sticks. And I preach, that one of the big benefits of CGM is being able to get away from finger pricks, sticking your finger. But a lot of people who've had diabetes for a long time, it's part of your life. It's part of your routine. It's kind of what you trust to go to. So I don't know. So what has been your experience personally and professionally with fingers, letting go of finger sticks and trusting the devices and whether or not they're accurate?
Yeah, it's a really good question. I mean, for me, I haven't tested in 6 months.
Finger prick.
Yeah.
Haven't needed to.
Yeah. I hate pricks.
Yeah.
And I have patients who test, I swear, 6 to 8 times a day. And they're wearing a continuous glucose monitor. And I do think that's unnecessary. Now, a lot of people will say, well, gee, when I do they'll drive themselves crazy. They'll say, hey, how come at the exact same time the numbers are off by 30, 40 points? Yeah. And theoretically, you should be within 20% of the finger stick. Now, remember, if your hand isn't clean or dry, or your strips are expired, your finger stick could be more inaccurate than your CGM device.
Right.
And if you're going to be basing your insulin off of the continuous glucose monitor, I could see why some people may get anxious that have been doing that way for a long time. But because you get frequent measurements of a CGM, everything seems to work out okay. I honestly, have you ever had a patient who said they overdosed because they injected off the CGM? It's because of the multiple readings, and the Dexcom and the Libre, they are always auto-correcting as well. And that's why, you don't typically calibrate.
Yeah.
The Dexcom, you can calibrate it. The Libre is factory calibrated, but I don't calibrate the Dexcom either. And I've even heard that if you try to calibrate the Dexcom too frequently, it makes it inaccurate.
That's right. It can actually make it worse if you're calibrating all the time. So I think, you can calibrate the Dexcom, but use that in that rare instance where it's just way off for some reason. But it's not something you really to be doing routinely, because it actually can negatively affect the accuracy of the Dexcom, which is interesting. I do think, if you check finger stick, if you're pricking your finger and looking at your blood sugar, the more times you do that, the more times you're going to find some outlier where, hey, it was 40 points off or 50 points off, just because that's what happens when you do repeated measurements of anything. But I think the point is, like you said, I mean, the accuracy of these CGMs are so good. The MARD, which is sort of the statistical test that we use to look at their variance from the actual blood sugar.
What does that stand for?
Mean absolute relative difference.
He's a genius.
The MARD, basically, for these new devices are under 10, so which is a great number, and that it doesn't exactly mean that, but it means roughly they're within 10% of the value in either direction, and that's just as good, if not better, than most of the glucose meters. And so again, no test is perfect, but we trust these just as much as we would trust a finger stick.
Yeah, I would also say this, that I acknowledge the fact that every once in a while you might get a sensor that is way off.
Mm-hmm.
I mean, I've had a Dexcom sensor where, it's rare, but I just knew that it was way off. Like I was feeling somewhat hypoglycemic, and then it said it was like 150. And then I tested with a finger stick. This hasn't happened in a while, and it was quite low. And I would say, if this happens, I would contact customer service. They'll send you a new sensor. And I always like to save the wrapper that has the serial number and the lot number in a location when I put a new sensor on. And then so if there's an issue, and I call customer service, they'll ask you
Smart.
for that information. And I do know that you can actually get your sensor replaced online now with the Dex Com. So it makes it easier, and you don't have to, call and be on hold and
Yeah.
things like that.
Good. What about, okay, so let's talk about connectivity. And so there's a couple questions here about the Freestyle Libre. And so there's a Freestyle Libre 1 and the Freestyle Libre 2. The first question is, does the Freestyle Libre 1 reader work for the Freestyle Libre 2? Unfortunately, no. So if you have an old reader from the Freestyle Libre 1 and you're upgrading to 2, you need a new reader. So that should be covered if you have coverage with your insurance, but you'll need to upgrade that. So those don't overlap. You have to have a different reader.
The scanning with a phone thing.
Right. And then scanning with the phone is another good question. So with each of the CGMs is different. So with the Dex Com, you can download an app and you can get all the information on your phone. With the Freestyle Libre 1, the older version, actually, you could scan with a smartphone and you can get the information right there.
Yeah, there's an app for
There's an app for it. With the Freestyle Libre 2, there isn't. I don't know why that's the case. It hasn't been approved for that. So you have to use the reader. So it doesn't go automatically. It doesn't go to a smartphone. And in order to get that information, for example, the full report, then you have to plug in that reader, and have that downloaded to the program.
For people that don't need alerts and alarms, let's just say you're on oral medications, the 14-day is nice because you don't have to carry around the reader.
Yeah, that's the Freestyle Libre 1.
Yeah,
so
and the Libre 2, like you said, it's a pretty big advantage to have the alerts that you could set yourself, and that was missing on the Libre 1. They call the 14-day, and then there's the Libre 2. And I don't know if you want to say anything about the Libre 3.
I mean, sure. While we're talking about the different generations, so we're always excited about the next big thing that's coming. First of all, if you're thinking about CGM, don't wait for the next big thing. Get the best thing right now, and then upgrade when the next big thing comes out. But I think in terms of the Freestyle Libre 3, that's the next generation. It's not available yet in the United States. My understanding is that it's a limited release currently in Europe. It's been approved in Europe, and the plan is for it to get released in full in Europe, if not now, very, very soon. And moving, towards the United States after that. The Freestyle Libre 3 has some good benefits. It's a much smaller sensor, so that the sort of the wear factor is improved, and that's true with each generation of Dex Com as well. They keep getting smaller and smaller, sort of less intrusive and just easier to wear. And so that form factor is improved.
It's not that big as it is now.
Yeah.
But it's just smaller.
It keeps getting smaller. And the other thing about the Freestyle Libre 3 is that it's going to be a true, instead of a flash glucose monitor where you have to flash over it, it's going to be a true continuous glucose monitor where it's going to be sending that data continuously to an app on the phone. And so that people who are wearing that device can actually see in real time what's going on without flashing, essentially, without swiping it. And again, it'll have all the alerts and alarms and all of that. So I think the Freestyle Libre 3 is going to have a lot of great features that we kind of currently see in the Dex Com device, but available to more people.
And the Libre sensors are waiting for FDA approval to be used with insulin pumps. Now, the Dex Com 7, if some of you have heard about that, first of all, the sensor is a lot smaller, like I think greater than 50% smaller. And the transmitter is in the sensor. And when you finish 10 days, you throw the whole thing out. So all you have to do is really get the sensors, which has the built-in transmitter. And they are working on a 15-day, but I believe the first release is going to be a 10-day. Even the Eversense implantable continuous glucose monitor, currently it's a 90-day life, and you got to get it taken out and put a new one in. But the company, Senseonics, is waiting to hear from the FDA about the 180 days. So you just put it in every 6 months, and it takes literally 10 minutes.
And that's so cool.
You've done it yourself.
Yeah, put them in. And just to be able to put that little thing under the skin, kind of leave it there, forget about it, be able to get that information every 6 months is pretty amazing. So the technology is great. So in terms of currently available stuff, what other features does the Dex Com have compared to the Freestyle Libre right now? Like, what does the Dex Com have that the Freestyle Libre is kind of catching up to?
Well, there's different form factors.
Yeah.
So for some people, the Libre is a good device for them.
Yeah.
But the Dex Com it does have the connectivity with insulin pumps. So we got the tandem control IQ, the people that are doing this thing called looping, pretty soon the Omnipod 5. The one thing that the Dexcom has, well, several things, but it does have the real-time sharing. So if you have a kid, if you have a husband that's cheating on you, no, he's type 1, you can follow his numbers at any time, even if we're on the other side of the earth. And so you can be alerted when their blood sugars get high or low, and you can set those alerts as you like. And of course, you don't have to swipe.
Yeah.
So those are kind of the biggies.
So yeah, I think, you know, sort of traditionally taking a step back, like I kind of always thought of Dexcom as, you know, the best device out there for type 1 diabetes because of these real-time alerts and alarms, you know, and you really need those if you're doing, you know, like intensive insulin. And I kind of thought of as the Freestyle Libre as like a great device for a lot of people with type 2 diabetes who want all that information about their blood sugars, but don't need all the bells and whistles of the Dexcom.
Yeah.
A little simpler in some ways. But that's sort of changing where I think that, you know, Dexcom is making their device accessible to everybody, type 1 or type 2. I think Abbott Freestyle Libre is sort of, you know, making their device better by adding alerts and alarms and those real-time features that make it also a good device for type 1.
Absolutely.
So I think, you know, some of those, you know, I think either device is going to be really good for all sorts of different people.
And you said this earlier that I would suggest that if you haven't gotten on a CGM yet, or you're thinking about switching, really look into each one because it comes down to what your individual needs are.
Yeah. So speaking of, if you haven't been on a CGM, you know, there's some questions coming in about coverage and cost. And this is always, it's a tough thing for certainly for people with diabetes and for providers too. It's a pain in the butt. It's my least favorite part about all this. Trying to get these covered. So, so this first question is, my doctor said that since I only test 1 time per day, I'm not eligible for a CGM. Could you please address this? So, you know, I don't know. I see
only 1 time.
Yeah, just 1 time.
Well, you know, one of the stupid rules are that these insurance companies say that your patients have to be testing 4 times a day. And that doesn't make any sense to me. You're not testing enough because you're tired of pricking your finger.
Yeah. And that comes from Medicare. And then most in the commercial insurance just kind of follow that outline. So you have to be checking your finger 4 times a day and doing multiple insulin shots a day to be covered under those plans, right?
Yeah. Well, I would test 4 times a day for a little while and then just Xerox the same sheet 2 or 3 times because it's dumb. I don't mind getting around dumb rules. Or you know, worst comes to worst, you may have to just suck it up and do it for the time that's required to get the CGM device. It's worth it. And so, you know, most doctors will help you get through that. And I also find that talking to the representative from the CGM company can also help as well.
Yeah, they can be helpful. And so I think one issue is coverage, like will your insurance pay for it? And / do you have the cash to decide to go out and buy it yourself, even if the insurance won't cover it, just because you think it's going to be so beneficial for you, which in some cases is certainly worth it. The other is, does your provider have any hangups on, you know, prescribing one of these devices for you, even if you're not on, you know, intensive insulin therapy? And that's kind of a different issue, but that's certainly another thing that people run into is saying, just the provider saying, hey, you don't need this, you know, you're only doing 1 shot a day or whatever. But we have actually good evidence that people who are doing just 1 shot a day of insulin or even not on insulin at all can benefit from these, can improve your A1C, you know, can help you make healthier decisions, get more exercise, eat better, all this stuff. And so there's actually true medical evidence to support that, even if the insurance isn't doing it yet. So
yeah. One other idea I just had is that both Dexcom and the Abbott Libre, they have free trial systems, and you can check it out on their website. And you could use that free trial to get the numbers you need to officially get approved by your insurance company. So that's another good idea.
Yeah, that's a good point. And so so if you are someone who is, even if you're pre-diabetic or if you're type 2 just on pills or something like that, at least go and try these devices. And the other thing is, even if you're not going to use one forever, or you're going to use one, for a 2-week trial period, you can still get a lot of information from it.
Yeah.
So I'll say, hey, even if you just wear it for 2 weeks, like you can learn a lot about yourself.
A ton.
And then I think in the future, these will be more and more available, and, kind of continue to push for it. And eventually people will be using these as sort of standard of care across the board.
Yeah. Something just came up that I wanted to say. It doesn't really fit into that part of our question, but I would really suggest, we can answer that question now about how do you prevent it from falling off.
Yeah.
Well, first of all, if certain individuals have allergies to the material in the sticky part of each company, and sometimes that's a real pain.
And they're different. Like, each of the adhesives is slightly different, so people have different allergies and irritations from one, maybe not the other, or vice versa.
And there are little tricks to the trade on that, and there's a lot of information, some of which is on our website actually. But the one thing I wanted to suggest to people that are wearing subcutaneous sensors is that there's companies on it that you can buy their stuff on Amazon.
Yeah.
One is called GRIF, GRIPS, GRIF, There's several companies, and it's really good sticky tape, kind of like sports tape. It's already got a hole cut in for the Dex Com transmitter and the circular Libre sensor, and you can put it right over it.
So it's like pre-fit. You just put it right on there to keep the sensor in
different
place.
Colors too.
Yeah. Designs.
Designs. Camo. Yeah. And it's, I can tell you that once a sensor falls out, you're done.
Yeah, you can't get it back in.
You can't get it back in. And, since the Libre does go 14 days, anybody that takes showers other than the French people, it could fall off. And I always tell my patients, just be careful not to knock it off. And if you cannot afford these GRIF grips or other companies, then even just getting a large Band-Aid, like the kind you buy that would fit over a skin knee, and you can put it over it. Your reader will scan right through it. So make sure it doesn't fall out, and that's key.
Yeah. And so make sure it doesn't fall out. There are those options. And then if you're having the other issue with skin irritation, there's other issues too, to put a barrier down between the adhesive. And so don't let that be a barrier to you using the CGM. There are a lot of tips and tricks, and especially, looking at Facebook and checking out the TCOYD website, people have thought about this and tried a lot of different things. So, but it is kind of a trial and error. And it's not always something that the company has, can fix for you, but there's a lot of hacks. Yeah.
And it's a serious issue for the few that have it, because they're very dependent on the CGM. If that happened to me, I don't know what I would do, but there are tricks of the trade. There's a good article on our website about that specific issue. Yeah. So check out the website. The next question is sort of, along the same vein. Are there places a CGM can or should not be worn? So, where can you wear your sensor? So I see on other forums where some people use forearms, biceps, calves, and even on their breasts. So, what do you think, Steve? Where can you wear the CGM? You can wear it anywhere you want. Yeah. Anywhere there's subcutaneous tissue. And what that means is you need a little bit of fat, right? Just a little tiny bit, and not a lot. Yeah, I mean, I've taken care of a couple women with really bad with cystic fibrosis. They get very skinny, and they also get type 1 diabetes kind of, and that on their breast is actually the only place where they have any bit of subcutaneous tissue. Now, the companies have to go to the FDA and study it in one spot. It would take them 10 years to get all the data to study it in all the different spots. But I'd say all bets are on. You put it any place where you got some subcutaneous tissue, almost like any place you can inject insulin. Yeah. So yeah, what do you think? So yeah, I mean, I think it's kind of a personal preference, basically, as long as it works there. But the go-tos, the approved places generally, and it's actually different by CGM, but the abdomen and the back of the arm are kind of the first places. I think but people wear them on their backs. People wear them, on their, sometimes even on their legs, on the upper thigh, if you have a little bit of tissue there. So well, Dr. Pettis is pretty self-conscious how he looks at the beach. Yeah. So he puts his sensors under his bathing suit. He puts everything on. I don't know how he fits that under that Speedo. See, I got my Omnipod over here. Yep. I wear my Dex Com on my stomach, and part of it's a real estate issue, like if what other devices you got, but yeah.
next question. What about CGMs and travel? Getting through airport security and that, do you need to get a pat down, or how do you deal with that?
Yeah, in a nutshell, get pre-check.
Yeah.
Because you don't have to go through this big old scanner where they scan your body, and that will pick up anything on your body. But the scanner will pick up things with heavy metal, and neither the Libre or the Dex Com or the Eversense, I'm not sure about the Medtronic, they do not set off the sensor.
Yeah.
And all the stuff in your suitcase can go right through, and you don't have to take anything out. But I have found that when you go through the scanner, if you don't have pre-check, a lot of times they'll say, what is that on your arm, your stomach? And then you have to, lift up your arms, and they search your body. And,
Yeah.
And so it's a hassle.
Yeah.
Get pre-check. That's all I have to say.
Yeah. Okay, good. And then, so here's a couple questions about accuracy. And we talked a little bit about some of this stuff, but these are specifically, so the one question is, hey, when I first start up my CGM sensor, even though it's you give it your warm up time, which depending on the type is an hour to 2 hours, and then accuracy can be off on the first day, and it's a common experience, and it's actually one that has been reported in the studies as well, that they're just not as accurate during that first 24 hours. And then another question says, hey, my I wear CGM, but it tends to kind of like conk out towards the end phase in the last couple days when really it should be working, but it's either dies out or the accuracy gets way off. So again, some of this we know from data, but certainly from just experience of people wearing them, that can happen. But yeah. I don't know. What do you think, Steve?
Yeah. Well, first of all, I think a lot of the studies have shown that in the first 24 hours, you may not be as accurate as the rest of the day. So it's probably a good idea just to keep your eye on things. And if your symptoms don't match the glucose, then get out your glucose tester, get the dust off at the cobwebs, and check. Yeah. Make sure your strips are good. And then what was the other issue? The second question?
It's sort of on the opposite end. So at the end of the sensor life, when it's also not working quite well.
Well, the end of the sensor, it should last as long as the company says, either 10 or 14 days for the Dexcom and the Abbott Libre. And if it doesn't, then you need to get a new sensor.
Yeah.
And always save that lot number, because the companies are trying to figure out what the issue was. They can really track when it was produced, what shift, was there something that happened, and they're always trying to improve quality of these things. And please don't be nasty when you call. These companies are making devices that are saving our lives, and they're doing their best.
Yeah.
And since CGM is more popular, their productions are going up, and they may develop some issues. It's really important to let them know.
Yeah.
They won't argue at all. They'll send you a new sensor, and it should last the whole day. And I find that with mine, I get accuracy all the way to the end, and very rarely does it conk out. But everyone's different. And, when these sensors go under our skin and there's all this blood and guts and subcutaneous tissue, everybody's different. Yeah. Immune system's different. And who knows, some people's sensors may gunk up more than others. I had a patient that I had to go through hell with the insurance company because his Dexcom only lasted 7 days. And he got approved to get get enough supply the last 7 days. So he's unusual.
Yeah.
But it can happen.
Yeah.
So I think I acknowledge that for sure.
We're getting close to the end of our time, but I want to bring up this question. This is actually a question from someone who says they don't have diabetes, but they're interested to know how different foods affect their blood sugar. And with the Freestyle Libre, which their question is about, how soon after I eat would I want to swipe and check? Yeah. And so, you mentioned that even these elite athletes, are starting to use CGM for training purposes. And so it's not crazy to think that people, even someone without diabetes, and certainly someone with pre-diabetes, could use that type of information to understand how foods are affecting our blood sugars. But how would you counsel this person if they can get their hands on a Freestyle Libre?
Well, Michelle, next time you have a bunch of donuts, I know you don't have diabetes. The answer is it should go up at the same time as someone with diabetes who does not have gastroparesis. Just make so their stomach motility is normal. You won't get the same excursion as someone with diabetes, but it should be the same time course. And, these CGMs, now that they're becoming more available, I do think it's going to help us diagnose people earlier, so you can
Yeah.
institute lifestyle modification.
Right.
And I think that if anybody's really interested in their blood sugars over a 24-hour period, and you can afford one of these devices and even go for the free trial for the first month,
Yeah.
I would do it, because you learn so much about how foods affect your system. And you should see what happens during exercise, during fasting, what happens to your blood sugar after eating, when you're eating a donut for breakfast versus eating a donut for dinner. And we expect that your blood
Yeah.
sugar after breakfast is going to be much higher.
Gonna be higher.
There's all these other hormones that work against insulin in the morning. So Michelle, I'll get you a CGM and you can try it.
And good luck with the 3 donut challenge, Michelle.
Yeah. Try to eat 3 donuts in 15 minutes.
Yeah. I think that in terms of the Freestyle Libre in particular, well, heck, any of these CGMs, you don't have to ask when to swipe, because you can swipe as many times as you want. You know what I mean? So it's not like you have to time it perfectly. So if you're swiping with the Freestyle Libre, if you're swiping at least every 8 hours, then you're getting all the glucose data.
Yeah.
So you could swipe an hour after eating, and you could swipe again 2 hours after eating, but you're going to get all that glucose data. It's all going to be on there.
Yeah.
Which is great. And certainly the same is true for the other CGMs, where it automatically, gets uploaded to your receiver or your smartphone. So all the data is there. It's at your fingertips. It's available for you to look at. And, one thing that we've talked about before, Steve and I, on one of our other videos that we call How to Think Like an Endo. And basically it's kind of how to go back and look, back in time at your own CGM data. So of course, you want to look at it in real time and see, okay, what's my blood sugar now? What's the trend? What did my last meal do to me? But look backwards over time. Look at the last 14 days, the last 90 days. And see, what's going on with your
trends
blood
and patterns.
Exactly. When are you high? When are you having lows?
That's a great video. It's a good call out for the video vault on our homepage.
Check it out.
Yeah. Now this question, let me answer, because some of you may not realize this vitamin C issue with the Libre sensor. Basically, the Abbott Libre sensor has not been approved yet to communicate with insulin pumps, where they can give you more or less basal insulin. Apparently, there's data that the FDA was concerned about, that if you take a ton of vitamin C, it will make your glucose value artificially higher, then that would lead to a higher insulin dose. So to be honest, the vitamin C levels, you have to take a lot,
like super mega doses.
Yeah.
Not like from your multivitamin, or you had an orange or a glass of orange juice.
But
like huge doses.
And
the thing is, although some people may do that, because if you read that vitamin C is good for you, people have taken a whole bottle of vitamin C if they got a cold or thinking about COVID. So weirder things have happened.
That's true.
But
That's true.
At sort of normal doses, it's not going to have a big effect on the accuracy.
And the folks at Abbott, they're working to fix that problem.
Yeah.
And I don't know if you remember the old days with the Dex Com 5, you could not take Tylenol.
Mm-hmm. Sure.
And that messed up the accuracy of the data. So, and then the folks at Dex Com fixed that problem too.
No longer a problem with the G6. So, okay. Well, Steve, I think that was the last question that we have here today. And that was a great question. So much fun. I love answering questions from real people, and kind of just, shooting from the hip a little bit, but we'd love to, obviously we're passionate about CGM. We love talking about it. We think it's the best tool now and for the future. And so this was just a lot of fun. Yeah, that is a lot of fun. And make sure you check out our website. If you have any questions, that we have several blogs, you can put your question there and we'd be happy to answer them. And this is a lot of fun. I like answering questions just off the cuff, and really appreciate your time. Thanks.